Welcome to the Holistic Health Bites podcast. I'm your host, Andrea Nicholson, here with bite-sized episodes to empower, educate, and enlighten you with ways to lose weight, heal your gut, and achieve your ideal health so you can live an adventure-filled life. Let's dive in. Welcome back to the Holistic Health Bites podcast. Today, we are joined with Patricia Carothers, and she's going to talk to us about being an advocate for yourself and what does that even mean? What can you do? And I'm really excited for this conversation because I think this is something that a lot of people don't know much about, and we all need to know more. So welcome, Patricia.
Oh, thank you. What a nice introduction. And yes, I agree with you. I think the topic at hand is one that people, while we might practice it all the time, and so it's very second nature to us, we come across people that they don't know that other opportunities for healthcare exist. So let me tell you who I am. I am Patricia Carothers, and I own a nurse case management company. It's national. We like to say that we're in the industry that spends $1 billion and nobody knows anything about it. Because our focus is on people who have been injured in the work comp field. And so it's specifically injured workers in the leg of case management. Now, people who are not injured workers, we address in our leg of care management. And in that regard, we provide private case management services. So for lack of a better word, concierge care, self-pay for people who are on a medical journey that they need someone to hold their hand. So that's us in a nutshell.
I love that. How did you get into this field?
Oh my gosh, what a good question. I think having been a nurse by education, late 80s, I'm dating myself, but I've been a nurse for a really long time. And, it becomes part of who I am, not just what I do. And my most favorite part about nursing was education through all my different experiences. So when I found this niche of case management, it had that. It had patient education, it had family education, and I just dove right in. And I worked for a lot of big corporate businesses, and I tend to see how things can be done smoother, easier, better, all keeping that injured worker or that patient in mind. So I hung my own shingle about 12 years ago, took what I knew from the big corporate, finessed it, polished it, and we just hit the ground running. And we haven't looked back. We've been busy ever since, really. So,
well, let's take a minute and just kind of talk a little bit about what you do as an advocate, especially for the more, people on a regular medical journey, because I think that'll apply to more of the masses of people listening here rather than the work injuries. Let's talk a little bit about what does that look like? What role do you play? What is it that people really need to know that you provide for them?
I think it's a good question, and I'll back it up a little bit because there may be some carryover, which is why I saw the field wide open for the private care. When a person is injured on the job, it becomes the most significant thing in their life, and they're alone and they don't know anything, and they don't exist in a vacuum. It affects their whole family, it affects the whole system. So we have that opportunity to come in as case managers, not always nurses. I should probably emphasize that, because there are social workers and other medical healthcare professionals that can do what we do. But we come in and we recognize that everybody has an agenda. Everybody around them has an agenda, but that center piece, the injured worker, the patient, is the one that's the most important. So when we took a look at, gosh, what do people do if they don't have a case manager out in the real world, away from the work comp world, we saw a real opportunity to help. And it comes from that place. It comes from that place. I sincerely want to help others. And yes, it's self-pay, and yes, insurance doesn't cover it. But that's a whole other conversation. People find a way, people manage. And there are pro bono opportunities. That's the right word for people to be supported by friends, family, community to pay for private health advocacy services. So in that role, we meet people where they're at. I know you do the same thing. And we start by listening. People present their issue, their concern, and we see where we can insert ourselves to help. Can we fix everybody every time? No. And if it's outside our scope, we have a list of resources that we can refer people to. But that's what it comes down to is we meet them where they're at, we listen, and we begin. There are packages for people who have maybe a diagnosis that is big and scary, and they may need help with understanding that diagnosis, finding a provider, finding support. Those are the big ones. It can be something as simple as I need help with my medical bill and I can't figure this out. And we have people that do that too. So it's quite varied how we help in our role. Does that answer the question?
It does. So you coordinate with, if they're working with multiple practitioners, you help coordinate kind of all that information that's coming in, as well as the billing side of it, and just kind of make sense of the whole journey.
Exactly. We help make sense of the whole medical journey, and we hold their hands while we're in it. Yes. We walk alongside them so that they, I'll tell you, Andrea, I've always been a nurse. And so for me, as we started in the beginning, it's second nature. My family will call me, hey, I got a rash. Oh, can you tell me what this is? Send me a picture. Or, gosh, I have a fever. I have a sore throat. Should I go to the gym today? I mean, everybody asks a nurse. And for us, it was very normal to advocate for ourselves and to find the information that we need. But as you come across people who don't have that experience, it's an opportunity to teach them that they can find a way. They can find a way to advocate for themselves and to find others to support them in that way too. Does that make sense?
Yeah, absolutely. And do you find that sometimes people are putting a little bit too much emphasis on any, say, one opinion, one medical opinion, or one piece of advice that they've gotten, maybe even not from a medical professional, but maybe a family member, and they just kind of put all their faith in that one basket, and they don't even know what they don't know?
Oh, I like that. And yes, I do find that they don't know what they don't know. And I would say the people that I come across that are like that, it may not even be age-based. It's just how they were raised. What has their experience been up to that point, whether they're a millennial or whether they're, in their late 70s. Sometimes they lean into that traditional medical model. And I'm a nurse, and I understand the benefit of a traditional medical model, but I welcome the outside opportunity for exploration. If it's not traditional, there are alternatives. And I probably did mention this in the beginning. Yes, I have a scientific clinical mind, but I'm also an energy worker. And so I understand that there are things seen and unseen that may work for people. And so I just want to expose that to people if they need to be opened up to it.
Yeah, I think we need to be open to all of the options. And probably we need all of the options. Like, there is no one magic pill that's going to fix it all, or one, yoga session that's going to fix it all. We need a little bit of both. There's a time and a place for traditional medicine and, prescriptions and surgeries and that model. And there's also a time and a place for eating a quality diet and sleeping well and managing stress and, meditating and doing all of these other things that are considered by today's world alternative, although those are actually the natural things that we've done as humans through all of history. We need both. And I think as a society, we've kind of become a little too reliant on our doctor to know everything about everything.
Yes.
And we kind of actually expect too much of them. And true of nurses as well. We expect them to know everything there is to know about every medicine, supplement, exercise, diet plan, meditation, yoga, all these. We expect them to know everything about everything. And when we get advice that either doesn't work or doesn't sit right with us, then we're like, well, that's what my doctor told me to do. Why are we expecting any one human being to know everything on the planet?
Yes, yes.
That's why
And
we
I
have
know,
specialties.
and you and I talked about this too, and not to, just the medical model, but physicians really only get about 2 to 3 hours of nutritional training in medical school. And they can't know everything about everything. They are not the be all end all. So yes, we tend to just lean into that if that's always been our tradition, and that's self-limiting. You're not seeing other options that might be available to you if you lean hard into one person, one opinion.
I think we just have kind of put them on a pedestal, which is unfair to them because then they're in the position to have to give you advice on things that they're not really experts in. I think there's some doctors out there who think they are experts in the world and they will advise you on all the things. But I think as a society, we've kind of done that to them. And I don't think that's fair. I don't think we should expect them to know everything. I think they should be totally okay to say, you probably need to see a personal trainer or a nutritionist or a whatever. Like for that piece of advice, you need to go see this other expert.
When doctors need to refer out to those people, our company tries to get in with those physicians and say, here's some options for you. Here's some resources in the community that you may not know about. We're here. Use us if you would like. Because really, when you get in to see your doctor, they schedule in 15-minute increments. And there's really nothing that's going to happen in 15 minutes. It takes much longer.
Yeah. I think that, and that's definitely a big part of the problem with the whole traditional medical model is it's really acute sick care. That's really all they can do. That's what you're doing in 15 minutes. You're dealing with the immediate problem in front of you and shove a pill or a surgery at it because that's all the time they have. They don't have time to really dig deep and understand what led you to this point. What's the underlying cause of this problem? Now, if it's a broken arm, they don't need to dig any deeper. They just need to fix it. But if it's diabetes or cancer or, one of these more chronic situations, you're not going to solve it in 15 minutes. Mm-hmm. And you're not going to solve it with any pill or surgery all by itself. It's going to take a much bigger picture, and you're going to need more than that one opinion to cover all of those bases.
And it takes some effort. The benefit of what I do is I can be in the room with that patient and their doctor. And I find that establishing those relationships is very helpful to everybody, to the professional, to the patient, to myself, because we can sit in a room. We have the diagnosis of diabetes, for example, and we can sit in the room and we can share for those 15 minutes. I'm taking away what I can then build on after that physician visit. And then the physician for the next visit doesn't have to spend time repeating themselves. So it's a win-win. But you're right, it doesn't take place just in that 15 minutes. It's an opportunity for us to build on it and to say, well, let's get you with a nutritionist. Let's do some more education on managing your blood sugar. It doesn't take place in the exam room.
Yeah, that comes back to the people just don't even know what they don't know. And without someone like you in the room, or someone in their life that knows these things that can advise them properly on what else they need, they don't even know what questions to ask.
It comes back to self-advocacy and even doing what I do and being who I am. When I'm the patient, I lose 60% of my hearing. I don't remember my questions. I am like a deer in the headlights. So no matter who you are, or how much you know, when you're the person in the hot seat, you can really benefit from having an advocate of some, maybe it's your husband, maybe it's a friend, maybe it's a case manager. But having a second set of ears and eyes in the room is key to success, I think.
I agree. And I think it doesn't even matter what you're going through. I went through this with both my dad and my husband having surgeries that were, orthopedic in nature. So it wasn't like a life-threatening thing. And yet they didn't hear a fraction of what the doctor told them. Just like you just said, when it's you forget all your questions. You're overwhelmed by what's coming at you. You're scared of this upcoming procedure. You've got all these things rattling around in your head and you don't hear half of what the doctor says.
Mhm.
Now, make that a life-threatening situation, and of course, you're not going to hear a fraction of what's going on because now you're literally scared for your life. So, yeah, I 100% agree. Whenever possible, take someone else with you to any medical visit because there will
I
be
agree.
things that you don't hear, things you didn't think to ask, whatever. They'll pick up on things that you missed. 100%. I agree.
And to expand on that, sometimes in my role, I will be visiting my patient in the hospital, and when the doctors and the specialists come in the room to make their rounds, and all of the interns are staring at them from the bedside, it's overwhelming. I encourage my patient to have their notebook. I've got my notebook. We're writing everything down as we understand it, so that we can follow up on maybe what we missed, the gaps, or wherever we need to identify what we're missing. It's better if it's on paper. Yes, 100% agree.
Yeah. Do you do a lot of work where you're not physically present in the room? Do you attend virtually with people, or do you always go into the room with them? How does that work if they're not near you?
So thank you for asking that. With when the big scary time in the world happened, and we were not able to be in the room with patients in their time of need, uh, that's a whole other conversation. We just hit the pause button, figured it out, and like everybody else, joined in the Zoom generation. So virtual meetings, FaceTime, whatever the injured person or patient could utilize in the room for themselves, iPad, iPhone, to even just a speaker, even just a speakerphone, wherever we could have a presence in the room because we weren't there physically, was super helpful. And we just did it. And at first people were, it was new, so
Yeah.
they were uncomfortable, but it became normal. It became the new normal. So yes, my preference is to be in the room. You pick up on nuances, of course, with facial expressions and body language. And I'll tell you, there are times that my patients share with me, "Oh, Patricia, when you're in the room, they really listen to me." And I simply say, "Gosh, I'm glad I have that so-called power, but it's unfortunate if that's really good. They don't have somebody in."
There's probably an element of that. Medical professionals like to talk to other medical professionals. You speak each other's language. There's probably an element of that, but there's also probably just a comfort level on the patient side, knowing that they're not alone, knowing that they have someone who can explain this if they get lost, knowing that it's okay that they ask any question that pops in their mind. There is no stupid question. There are no silly questions. It's your life. You have to be able to ask all the questions and get legit answers. And I think just having someone in the room that is your support maybe gives them more confidence in asking the questions, in listening to the answers, and not feeling like, oh, I missed what he just said because someone else is also listening. And so I think the whole thing probably just goes smoother.
And if they have some like historical success with advocating for themselves and having a good outcome, then it's easier the next time it happens. But if they've never had that experience that people listen to them and they don't know alternatives or they don't understand what questions to ask, then they're sort of defeated. I'll tell you a story. It just happened what is today? It happened this week. My son lives in another state. Phone rings at 2:30 in the morning. Of course, if it's a family call, you always answer it at 2:30 in the morning. He was playing hockey, threw his back out, and he didn't get a hit. Ask all the questions. Did you fall? Did you hit? It just was an odd twist, is what it turned out to be. So he called that. That was the phrase. He called it, "I threw my back." And so we managed it over the phone with, your home methods, your anti-inflammatories, ice, rest, pillow comfort, positional comfort. And then we started down the road of, okay, got to get in to see a doctor. And it won't be at 2:30 in the morning. We can manage this. It's urgent, but it's not emergent. So the next day he made the appointment with the doctor. And sure enough, I couldn't be in the room with him, couldn't get the speaker to work or the virtual to work. And so the questions that he had lined up, he comes out and he calls me afterwards. Questions 1, 2, and 3 didn't even get answered. So in my world, I would then write a letter to the doctor if it was my patient. But in my family world, what that means is another visit. My son has to go back. He's got to pay another copay. He's got to get his questions answered. So you start to see that it's also a monetary stress too. And some people just give up and they just live where they are.
Yeah. It's so sad. Kind of on those same lines, but a little bit different. Have you encountered any of your patients where maybe the doctor gave them a recommendation that they're not happy with, not comfortable with, don't agree with, and they either want to have a deeper conversation with that professional, or they actually want to go find a second opinion or, find a different medical professional? Have you had to handle like conflicting opinions or any of those kinds of things?
Absolutely. Absolutely. And, sometimes it's merely a clash of personalities. It's not a good fit between patient and provider. That does happen. But just recently, I had a young lady. She was working in a medical cannabis dispensary and was assaulted by an unruly customer. So she was sort of beat up, tossed around. Low back injury, neck injury, all soft tissue, nothing broken. But you understand too, soft tissue is longer, difficult to address. So they put her provider put her into physical therapy. Well, this patient was just in so much pain and so much discomfort and was convinced that the physical therapy was aggravating her shoulder. She was convinced that something was going on deeper with her shoulder that people were missing. So she simply quit. The recommended treatment plan was physical therapy, no diagnostics, just go right to PT. And her body told her no. She listened and she quit physical therapy. So of course she appears on paper to be non-compliant simply because she made a choice by listening to her own body and being her own self-advocate. We went back to the physician and really we had to make a big presentation. It was just to say, yes, we haven't done the 8 sessions of physical therapy. We really need an MRI of the shoulder. Okay? So she didn't listen to the PT advice. She listened to her body. She went back and with my help, she was able to ask for the appropriate diagnostic and MRI. And sure enough, there are issues there that shouldn't have been messed around with in a PT session. So it happens. It happens all the time. And I think how many people just suffer through the PT and say, oh, this must work or this must be good for me because it's hurting me. You have to speak up. You live inside your body. You know your body best. So believe that.
Yeah. Yeah. I had a client similarly who has early osteoporosis and she had a back fracture from just routine, like moving a plant in her house. Like it wasn't even anything serious. And same thing, they sent her to PT. Like PT is going to fix a bone. She ended up with 3 additional fractures from doing the PT. Like now, this is of course making PT sound like the worst idea ever. That is not at all what we're saying. These just both happen to involve PT that wasn't their fault, both of which were prescribed to these people. But it's just without the proper information, without the proper data, you can definitely go down the wrong path. And this isn't just MRIs and X-rays and those kinds of things, but the proper lab testing. You could be over-medicated or under-medicated or on the wrong medication altogether if you don't have the proper data. And these are the things that I just so wish more people knew because, I mean, how do you even know what lab tests you should have ordered? That you just kind of have to rely on your provider to tell you these things. But unfortunately, because of the insurance model that we're in, they run the minimal possible. And that's not always in your best interest.
I agree with you, Andrea. And I think you used the phrase earlier in our conversation, you don't know what you don't know. So how would you know what lab tests to order? This has never been your area of expertise. You've been a bricklayer or you've been a truck driver or you've worked in a medical cannabis dispensary. You don't know labs. You trust your provider to do that for you. Luckily, there's services like you offer that people, along with the lab testing and the education that goes along with it, that information spreads, and people are starting to wake up.
Yeah, it's just unfortunate that our system is so run by the insurance industry, because really that's who's deciding. It's not even your doctor. The insurance industry is making the call because of what they will or won't pay for. And all of it is based on diagnostic codes. So if they can't diagnose you with something and therefore prescribe you something, they won't do it. They won't even look. But there's a whole world of things that don't rise to the level of a diagnosis of a disease or a serious condition. There's a whole world of things that can still be improved, that can still be fixed, that your doctor can't do anything about because it's not a diagnosis or a prescription.
I think more and more people are recognizing those very limitations that you're talking about with the insurance model. And that's why more and more people are turning to concierge care.
Yeah.
They're trying to, I take good care of my car. Why wouldn't I pay to take good care of my body? I mean, that's a very simplistic analogy, but, for the cost of whatever your daily coffee habit is, you can actually put that towards health investigation in a concierge model.
Mm-hmm. Yeah. And just like with your son's example, you could keep paying copay after copay after copay after copay, hoping that eventually you'll get the answers, or you could just pay cash for a quick targeted program that actually gets you all those answers. And then you never have to worry about it for the rest of your life because you now have that information at your fingertips. You're more educated. You're more informed in what to ask for, how to advocate for yourself, what resources are out there. You can, spend what seems to be a lot of money up front, but it's over with. You're done, instead of copay after copay and fighting with your providers and, digging for all of this information. You can get it much quicker if you just are willing to put the money up front.
So how do we get that word out? How do we spread it far and wide? We're doing the best we can one by one with our clients. I think both of us can agree. But how? How do we share with more people? Well, podcasts. Here you go, podcasts.
Yeah, I think resources like this are very helpful in just opening people's eyes to knowing what else is out there. I think that's a huge starting point. I think, like you said, there's more and more people looking for this kind of care that's not under the umbrella of insurance, that's not limited by what they will allow us to do and say. And also, there's more and more providers that are fed up with being hamstrung by the insurance model. And they're stepping away from that model and moving into the concierge model or the, outside of the insurance model. And I think there's a movement of people who both want it for themselves and want to provide it because they know that the current sick care model isn't working for all things. It works phenomenally for car accidents and broken arms.
Trauma.
It does not do well for chronic care.
I agree with you. Again, I'm a nurse and I'm not out to change the traditional medical model because for what it is very useful. But I do want people to expand their horizons and be aware that there are other options.
Is there anything else you'd like to share about people becoming their own best advocate, resources that they can look into, your services, just anything else you'd like to share as we wrap up this episode?
I think that we probably agree that as many as people that are in this industry, you have to be selective on who you're choosing to be your partner in concierge care or advocacy medicine. And so check out their credentials, check out their experience, ask for references, if you will, before you connect with that individual, because it is your health, it is your body, it is your money. So I would just say be very careful because there are a lot of people out there with what does my husband say? Vaporware. They look great on paper, but it's kind of thin, not really clear. So go do a deeper dive into who you choose to work with.
I think that's great advice. I think we should always advocate for just knowing who we're giving our trust to in every arena, not just in healthcare, but I think we should always do our due diligence and know exactly what we're getting, what we're paying for, what we're signing up for.
And with that, I encourage people to believe in what their own inner physician is telling them, because like I had shared before. They live inside their body. They know their body best. So trust that inner voice and ask for help. Ask for help when you need it.
I think that's a brilliant way to end it. Thank you so much. If anybody wants to connect with you or learn more about what you do in your work, how can they find you?
Oh, I have to lean on my partner, my website developer person. So please look at the website, and that's MyNetRN.com. And they'll find all that information on there. I'm also on social media, LinkedIn, Instagram, and Facebook.
Awesome. Well, we will link up all of that information in the show notes for people to easily click on and find you. Thank you so much for sharing all of your wealth of knowledge about being an advocate for people, both for people to be their own self-advocate and for the services that you provide for people who need extra support and extra assistance in these complicated medical journeys. So thank you so much for your time, and we'll catch you again soon. Thank you for listening to this episode all about how to be your own best advocate. This is one of the top pieces of advice I can give to everyone. You know your body best, just like Patricia said, so always advocate for yourself. If you would like to contact Patricia, you can find all of her information in the show notes. Until the next, be well and vibrant. Thanks for being a faithful listener to the podcast. I'd love it if you left me a 5-star review on this podcast so that others can more easily find this valuable information. Did you know I also work one-on-one with clients? I approach solving health challenges like I approached solving crimes, by conducting a thorough investigation into your case. Whether you're looking to lose weight, boost your energy, fix your digestive system, or reduce inflammation, I can help. All you have to do to get started is book a free call. The link is in the show notes.